The arrival of the new millennium saw a shift to a more digital lifestyle. ICT has augmented our living, enabling unprecedented connectivity, access, and interaction with the world around us. COVID-19 lockdowns accelerated digitalisation. Online platforms became the primary means of accessing education, healthcare, and services. In the absence of physical proximity and connection, we had to learn how to live our normal lives online. In a quarantine world, our perspective towards our health took a digital turn. The State of Households 2024 has found that digital use rose during COVID-19 but was not sustained evenly. That our 30-year effort to digitalize our public healthcare has met mixed results, and the digital system supporting our healthcare needs to be patient-centric and more inclusive.
Both digital access and use saw significant growth during COVID-19, but this growth is not sustained in all areas and is uneven across social groups. The urban-rural gap in household access to ICT services and devices, especially in computers, has narrowed. However, a divide actually remains. Access to broadband in rural household is lower than in urban household. The type of broadband also matters. Fixed broadband remains consistently lower than mobile broadband access in both urban and rural households. Different age groups use internet differently. For example, once the pandemic ended, e-commerce and internet banking remained high only for those under 50 years old. Use of online health services dropped for those above 6 years old, and the jump in internet use reflected a necessity during the pandemic. But it is the sustained use afterwards that matters. So public healthcare is one of the biggest industries affected by COVID-19. The pandemic highlighted the importance of a digitalized healthcare systems and our struggles in upgrading them. So as at 2020, we reported that 25% of our 146 public hospitals and 9% of our 1,090 public clinics are digitalized. Efforts to incorporate digital systems into Malaysia's healthcare delivery has long been an aspiration of the government. But COVID-19 has shown us that it takes a lot to digitalize the healthcare sector. The governance of digital health systems doesn't have provisions on managing health data. At this point in time, Malaysian patients are unable to delete or restrict access to their uploaded records. Furthermore, the Private Healthcare Facilities and Service Regulations 2005 actually prohibits health record sharing between Malaysian public and private healthcare facilities. We are making progress towards a nationwide future-proof digital healthcare system, and our systems needs to be patient-centric and inclusive. So COVID-19 has shed much needed light on what is lacking in our digital healthcare system and has provided the impetus for us to do more and faster. We need to ensure appropriate legislations are established for effective governance of health, including data privacy, data security, and ownership. Furthermore, proper budget and funding needs to be allocated for the entire life cycle of our digital healthcare systems, and not just in the implementation. And we must also set a new standard for the collaboration and integration of public and private healthcare sectors for a more holistic healthcare approach. COVID-19 has made the world more connected. We can do more to educate our household on their digital rights and habits and use all the technology at our disposal to provide better digital living and healthcare for all. Some of the findings that we had in this report shows us that there is still very wide inequalities, even though there has been much progress, especially in terms of urban and rural household access, in terms of meaningful connectivity that we can achieve. For example, most of the rural household actually uses smartphone to access internet. I think those are things that can be highlighted for closing the digital divide in a more meaningful sense.